Increase overall weekly vaccination distributions to states, tribes, and territories from 8.6 million doses to a minimum of 10 million doses.
President Biden less than an hour ago announcing plans to boost states' weekly supplies of the COVID-19 vaccine by around 17%. His administration is also purchasing an additional 200 million doses, 100 million from each Moderna and Pfizer. Now that is in addition to the 400 million combined doses the companies have already committed to providing the United States. The expansion would create enough vaccine for nearly every American to get fully inoculated by the end of this summer. News that the vaccine rollout is ramping up, coming at a very crucial time. Today, global cases on the coronavirus surpassed 100 million, and health experts are predicting the number of COVID deaths in the United States could surge past 500,000 by next month. Governor Kemp says as Georgia waits for the federal government to increase allotments, the state is taking steps to speed up distribution. Joe Hankey explains what Georgia is doing and not doing.
This morning, Governor Brian Kemp and state health officials said demand from people around Georgia who want to receive a COVID-19 vaccine is very high. And their goal right now on the state level is to make sure that they are able to meet that very high demand when the federal government increases shipments of vaccine doses to states.
At some point, whenever it is that they tell us that we get more supply, we are going to be ready to deal with it from the state.
Governor Brian Kemp today says preparing for larger COVID-19 vaccine shipments involves making sure there are enough hands on deck to administer shots. Through executive orders, Kemp is expanding the number of healthcare workers that can administer shots, and State Public Health Commissioner Dr. Kathleen Toomey added that will include school nurses.
In my discussions with the school superintendents, I emphasize that school nurses will be able to deliver vaccine both to staff and others eligible in the schools. And so we are ready. We can do all these things ahead of time.
Kemp says the state is also working with counties, especially smaller ones, to make sure resources are in place to handle demand for scheduling appointments and correct past errors.
County public health sites that have gone down, we've had call centers that have been inundated at the county level, and we tried to be very transparent and let people know we felt like with these issues would come, just like it did with testing and other things, and we're going to continue to learn from those, fix them, move on, and make it better.
To date, the state reports 713,923 Georgians have been vaccinated, including 216,000 in the past week. When asked this morning if the state is currently working to update technology and offer a system where detailed information on distribution, demographics of Georgians vaccinated, along with centralized appointment scheduling can be found, Kemp said now is not the time, in his opinion, to make such a move.
Just to move off of a platform, even though it may be antiquated, is currently working to something that we're not positive about, and doing that prematurely could be disastrous.